I'm Judith Olo, CEO of the East African Center for Human Rights, which is a regional NGO based in Nairobi. The East African Center for Human Rights works in Kenya, Uganda, and Tanzania, and our mission is to promote and protect economic, social, and cultural rights in Africa through partnerships, capacity building, and knowledge management. The East African Center for Human Rights was set up after a research revealed that civil and political rights were given more preference than our economic, social, and cultural rights, and therefore it was established to stand in the gap, providing for children who are a marginalized part of our community. Our work revolves around right to health, right to education, as well as child protection. Now, Watoto Wetu project is one of our main projects that is implemented within Kenya, and specifically in 3 counties, that is Marsabit, Kajiado, and Garissa. Our work, especially in Kajiado County, has been quite significant, that saw the rolling out of a policy or a county policy on anti-FGM, and in the long run, we tend to see that policy is actually rolled out countrywide. The main objective of this particular project is to ensure that there's more awareness and also government involvement in protection of children against harmful cultural practices, especially FGM, as we all know that is a cultural practice that is common in this region, aspects of early marriage, and also quality of education that is wanting. Thanks to EACHRights development partners, now we are in phase 2 of this project, and we continue to change lives of children each and every day.
Since the year 2017, the East African Center for Human Rights has engaged with Marsabit County government, residents, and children in consultative forums, whose end result is formation of the Marsabit County Integrated and All-Inclusive Child Protection Policy. Child participation is important as it gives children a chance to talk about issues and decisions that directly affect them. It is for this reason that the East African Center for Human Rights involved children and adults by collecting the views and recommendations for the policy.
In the current program supported by EACHRights, you cannot come up with a policy without involving those who are going to consume that particular policy. There is a big need to involve the members of the public, especially those who are going to consume whatever you want to come up with. So if you don't involve them, they might see it as an alien. But if you involve them, maybe they contribute towards development. It will be owned by them, and it can also be supported by them because they are the originators of this particular policy.
Notably, Marsabit Women Advocacy and Development Organization has been instrumental in assisting the East African Center for Human Rights with mobilization and organization of the consultative forums.
Kwa majina naitwa Nuria Golo. Mimi ni Chief Executive Officer wa Marsabit Women Advocacy and Development Organization, CBO inayotetea haki ya watoto. Tumefanya kazi nyingi na hawa, na watoto wetu wamepata kuhamasishwa juu ya haki zao. Na siku za mwisho ama kazi ile tumefanya mwisho na wao sasa ni kuhusu mambo ya sera za watoto katika kaunti ya Marsabit. Tumechukua maoni ya watoto. Tumeshangaa kuwa watoto wakipewa nafasi wanajua shida zao na wanafahamu haki zao pia. Nami pia kama mtetezi wa haki ya watoto, nashukuru wamenishikia mkono tangu kitambo, wameniwezesha kwenda New York nikashiriki katika mkutano ya CSW, nikajua mambo mengi. Ya mwisho pia mimi nakaa kwa board ya National Council for Children's Services at the national level, na pia hiyo ni kuangalia haki ya watoto wa Kenya wote. So kama kazi yangu haikuangaziwa na EACHRights, singepata hiyo publicity. National Council wajue kuna mama Marsabit anatetea haki ya watoto.
The few of you are the representatives of children in Marsabit County.
The East African Center for Human Rights continues to conduct strategic policy advocacy for the benefits of children in pastoralist counties of Marsabit, Kajiado, and Garissa. Efforts have been paying off, and the most recently witnessed one is the launch of Kajiado County anti-FGM policy in Mosiro, Kajiado County.
We know fully well that the vision of the president to end FGM can only get results at the county level. And so it is indeed very pleasing to see that Kajiado County has led the way.
My name is Hassan Nur Abdi. I am a pupil at Moyale Primary School, and this is how we want these problems to be solved. There are schools that don't even have toilets. I'd like toilets to be constructed for them.
My name is Kabale Kasim. I study at Butiye Primary School and I'm going to class 6. Our home is very far. I come across until here Butiye. I would like for you to provide us with bus transport. The government should help us to stop overworking the children and employing them.
When I was in class 3, I loved going where mature girls went. And one time a teacher asked me, "Why are you coming here?" I said, "I want to know more about female genital mutilation." One time I had my mom saying that I will be circumcised in the month of December. She went to school the following term and asked my teachers why I should not get circumcised. The teachers told my mom that if I get circumcised, she will be fined and jailed. My mother finally agreed to the decision of not circumcising me. I currently speak as an ambassador in my community. I'm so happy that I am not circumcised and that some girls my age are also not circumcised from hearing my testimony.
In Marsabit, most people are livestock keepers, so you'll oftenly find children not going to school but instead spending their days herding. My sister who studied works at Lysamis. The day I joined school, she took me there in secret. My father did not know. This is not something new to us, it's something we're used to. The movement from one place to another in search of water and pasture. My name is Ali Guresau. I am a student at Cholbi Boys High School. We have learnt a lot about the problems faced by children in Marsabit County. The main problem being drug abuse. The government should control or search for a way to educate people about the drugs and also to take children to school.
Today in Marsabit, the issue of insecurity is a key issue. Every mind that is moving in Marsabit County, every mind that is moving towards Marsabit County is cautious about his or her security. Am I secure even in Marsabit County? Issue of drug and farming. Water is there. Though at a distance, water is there. Enhancing of good storage facilities and reclamation of land for farming. Our recommendation is, for the tribal conflict, we are requesting promotion of peace, enhancing strict policy against cases of FGM. In the society today, the society is more of unified against that person who is against FGM than going against the FGM itself. Allocating resources in the health sector. In our county, we might have a patient taken from Sololo coming to referral hospital, but due to lack of attendance, the child might die just lying in the hospital bed.
Security is a big issue in our county, especially between the, I'm sorry to say this, but I have to, between the Borana and the Gabras. Like if maybe for example, I hear my dad talking ill of the other community, I should not be encouraging it. In fact, I should be discouraging him against it.
I like issues concerning children's rights. We have learned a lot about our children's rights, and one of the violations of the rights is female genital mutilation. We strongly stand against FGM because it's carried out when the girls are very young. Another violation is child marriage, a very bad practice that prevents children from enjoying their rights. We strongly stand for children's rights and commend EACHRights for bringing this forum here, engaging with us. We promise to share this good news with other locals in our villages and share the same with our children.
Marsabit County is the second largest county in the country. Though population-wise it is of about 300,000. Among the challenges that children face in this particular county are more related with cultural issues, whereby there are some values that are considered acceptable among the communities living in this county, but which tend to affect the rights of children. We have issues to do with natural calamities, for example the drought, which often affect the ability of parents to take care of their children. We have also issues to do with inter-clan fights among the communities living in this particular county, which also contributes a great deal on the development and survival of children in this particular area. Our department, under the Ministry of Labor and the Social Protection, we have specific programs that are geared towards protecting children in the country. Among these is the normal protection programs, rescue cases. We advise, we refer cases to court. For example, last financial year, we had a total of about 1,600 cases referred to our offices in Raisamis, Moyare, Central and Noto. But the number does not reflect the real issues on the ground, because we still have a challenge of staff and the fact that the offices are placed in areas where not all can be able to access. So had we maybe officers in all the potential areas, we could be having a bigger number than the current number. But on the economic front, under the cash transfer program, specifically for orphans and vulnerable children, we are able also to reach the most needy in the society, especially those children who stay with the caregivers and receive a stipend of 2,000 shillings per month, which is paid after every 2 months. We have also a program under the same, which is geared towards supporting orphaned children in secondary schools.
Some of the difficulties that bother us here in regards to children are the dropouts. Factors that mostly contribute are things like drugs and lack of food. Since people here are mostly pastoralists, when they move, the food offered by the office of the DC or the county government becomes insufficient.